Hello, I'm Claire Daniel and I'm the Chief Psychologist at Buckinghamshire Healthcare Trust, and I'm going to talk about the role of psychology when you have AMD.
How can thinking about psychology help me?
The first thing to think about is that I think people often think that if you have to see a psychologist or if you have to think about how you're feeling with AMD, then somehow that that's sort of a bit of a blame about you, and it's not that at all. When psychologists get involved with people who have AMD, or we ask you to think about how you're thinking and feeling, it's because we know that things like AMD can have an impact on you and your life. And so it's about thinking about how you can live your life as full as possible, thinking about psychological principles. It's not a suggestion at all that the condition is psychological. It's not about curing the condition. And it certainly isn't about positive thinking, which I think a lot of people tend to think. It's about the fact that being diagnosed with AMD can be a shock, and you will have understandable and quite normal response to that in terms of how you think about it and how you feel about it. So how do you pull the role of psychology into something that's a physical condition? Well, if you think about this diagram, it shows how the way we think and our emotions and what we do, so our behaviour or our actions, and the sensations or some things that are going on our body are all linked to each other. And if one changes, then it will maybe likely to change the other three. So if you have AMD, of course that's the body bit of that diagram, and then having AMD will probably make you think about having AMD, and that might lead to thoughts such as why did I have it, or why me, or it's not fair, and that of course will influence how you're feeling as well. The important thing is of this diagram is it's the way that we interpret the situation we're in that can have a helpful or an unhelpful effect on that cycle. So as I said, common thoughts are very much about things like I'll never enjoy my life anymore, or my life's just going to get worse, or I'll worry about the future. So quite understandable again, but if you think about it, quite unhelpful thoughts, because those thoughts will lead to anxiety or fear or worry, and also might lead to different behaviours, so you might isolate yourself quite a lot. And it's not uncommon for people to feel frustrated and very sad. And if you are thinking like that and feeling like that, that will have an effect on what you do in your life. As I say, you might isolate yourself, you might not see your friends, you might stop things that are very enjoyable in your life, and that can then have feedback into how you're thinking and feeling.
So what can I do?
So it's important to think about how this cycle of thoughts and feelings and behaviour and what's going on in your body, think about that and what you can do about it. When you have a diagnosis such as AMD, it can feel as though your life's uncertain and your future's uncertain. And what's important is to think about the things that you can control and change, and the things that you can't control and change. So the things that you can control or change, so things such as understanding AMD, might be an obvious thing to say, but if you don't understand AMD, you may well feel fearful, anxious, worried. So understanding AMD is a really important part of managing life with AMD, because it'll help to reduce your fear, and the unknown can be frightening. It's important to ask questions. Don't feel daft about asking any question. No question is a stupid question. So ask the doctors or whoever is caring for you, so that you do have a good understanding of AMD. And you might be offered some equipment that you can use to help you live life with AMD. Now, sometimes people might think that using equipment or aids is a sign of weakness or admitting that you have AMD. But if you think about that, that's a thought about it, that's going to make you not accept the equipment that will help you. So rather than seeing equipment as sort of maybe a sign of weakness, it's important to think about it as a sign that you can regain some of your independence and enable you to continue to enjoy your life. And it's also important to think about the support that you can receive from people around you, so family and friends. And again, people might think about asking for support as a sign of weakness, or maybe feeling a burden on your friends and family. And we hear things such as, oh no, it's okay, I'm managing, when actually maybe someone isn't managing. So thinking differently about asking for help is really important. We all need help at some part in our lives, and asking for help can be difficult, but actually really important. And it's about negotiating with the person you're asking for help, so what you can do for them, but equally what they can do for you. And there are groups and support out there, but some people don't like meeting groups, and that's absolutely fine. But if you're somebody that maybe wants to meet other people with AMD, then seek out those support groups and see how you get on with them. You might go there and not like it, and that's fine, but maybe give it a go.
I do all of that, but I still can't accept having AMD.
So far I've talked about the things that you can do to help you live with AMD, and maybe the thoughts behind maybe you're not accepting help or support. And now I'm going to talk much more about thoughts and emotions. A lot of people might say, well, yes, I am using all the equipment that they're giving me, but I still can't accept that I have AMD. It's important to think about what acceptance means to you, because I think some people think of acceptance as giving in to something like AMD, just giving in, just not living your life. Actually, acceptance can mean something very different and much more helpful. It means developing ways to live alongside a condition such as AMD, to live your life as full as possible. And to do that, it's really important to be thinking about what are your values. And by values, I'm talking about what's important to you, what brings you joy, what's meaningful to you. It might be family, it might be learning and developing yourself, it might be things such as being creative. Values are often one word, so it's important to think about what do you do during the day, or what did you used to do during the day that helps you feel as though you're enjoying life a bit more. And think about, have you stopped those? And if you have stopped those, then it's important to think about other things that you can do that will help you meet that value. So for example, you might have a value of family, and you maybe used to drive and see your family every week. Well, it's thinking about what you can do to be able to still see your family regularly, but maybe without driving. So it could be that one week they come to you, and one week you go to them in a taxi. If you're somebody that likes learning and you used to read a lot and you can no longer read, it might be about getting audiobooks. If you are very creative and you used to love things, or you do love things like knitting and art, it might be that you start to knit things with bigger needles and you get chunkier jumpers and things like that. It might be that as you're knitting, you need to learn to adapt your position of your hands so you can see the knitting a bit more easily. I'm saying that try and adapt and try and learn different ways for you to do things that still give you joy and meaning in life. It can be very tempting to think about, well, that's too hard and it won't feel the same if I do things like that, and I won't enjoy things like that. But that can mean that you then stop things that you enjoy, which is pretty frustrating and sad, I'd imagine. So what can you do about these thoughts that are telling you, no, it's not the same, I won't do that? Well, as I said earlier on, it's not about thinking positively. It certainly isn't about thinking, hey, come on, I've got AMD and it'll be absolutely fine. It's difficult living with AMD, so trying to be too positive is just not realistic. It's about thinking helpfully and realistically. Because as I said earlier on, you can have very understandable thoughts, but they can be quite unhelpful and drag you down. All of us have what we call negative automatic thoughts, and these thoughts will go in and out of our minds quite quickly and we don't notice them, but we do notice how we feel as a result of them. So I might have a thought of, I can't do something very well. I might not notice that thought, but then I certainly would notice feeling anxious. It's quite important to catch those thoughts, so notice when you're having them, and to look at them and think about, well, how can I think differently? Or why am I thinking like that? And what's the evidence to support my thought? It may be something like, oh, there's no way I can read or listen to books anymore. Well, challenge that and just think, maybe I'll give it a go. I might find it hard to start with, but I'll give it a go. And it's about being kind to yourself as well. We often are unkind to ourselves, but might be kind to friends. So it's worth looking at that thought and thinking, would I say that to my friend? And if the answer is no, then it's thinking about, well, what would I say to them? And why am I saying it to myself? And can I be a bit kinder to myself? And it's also really important to be curious about doing new things rather than just, as I say, shutting down and thinking, no, I'm not going to do them. It's about being curious and new ways of doing things. Think about what are the obstacles, what's getting in the way of me doing things I enjoy, and be curious about how you can move on and remove those obstacles. So a lot of the unhelpful thinking will understandably lead to very difficult emotions such as depression and anxiety, maybe frustration and anger. And as I keep saying, this is absolutely understandable, but again, not helpful in terms of how you're managing your life. We don't want you to be feeling depressed and frustrated and angry. So it can be tempting to push away the emotions, and it can be tempting to push away the thoughts that are resulting in those emotions. Depression can often be triggered by feelings of loss, and of course there is loss associated with AMD, such as clear vision, maybe some activities, maybe independence. And it's important with any loss is to give yourself time to grieve, and that's about not blocking out your feelings. And this may take time. There's no set time about how long it's going to take to feel slightly more confident about living with AMD. But if your mood does get in the way of you living an enjoyable life, then seek support from your GP, because you might need help from a psychologist. And anxiety, so I talked about depression. Anxiety is often about how we feel as though we have a threat. We feel as though there's a threat coming very quickly in the future. Our anxiety is often about us overestimating the chances of something happening and underestimating our ability to cope with it. And if that's you, maybe think about, am I overestimating this thing happening? And we often, as I say, underestimate our ability to cope with it. So actually look back and think about how well you've coped with difficult situations, because you will have done. And try not to focus on the times when it's been more difficult, and think about the coping strategies that you used. One really good coping strategy just during a time when you're feeling anxious is called abdominal breathing. When we're anxious, we feel very shallow in our breath, and we're breathing sort of around our chest and our shoulders. And at those times, I think it's important to move your focus of your breath and put it down into your abdomen or your tummy, and just notice your breath in your tummy and your tummy going up and down rather than your shoulders going up and down. It's a very useful way of just feeling a little less anxious and calmer. If you want to learn more about abdominal breathing, it's also called diaphragmatic breathing. You just look on it at the internet and you'll find some information about it. Some of you might feel angry, and now often behind anger is a sense of unfairness and questions such as, why me? Why did I get AMD? And it's not fair. And again, absolutely understandable thoughts. The key here is to think about, can that thought or can that question be answered? And if it can't be answered, then going over and over it again actually isn't helping you, because that just might lead to increasing anger and increasing frustration. Frustration is often about experiencing obstacles and blocks to things that you want to do. So the obstacles and blocks to maybe moving towards your values that I mentioned earlier. And if you feel frustrated, I think it's useful to think, what are the obstacles? What's getting in the way of me doing what I want to do? And take a bit of a step back and think, and how can I problem solve that? What can I do differently? Are there other ways I can manage this? And give it a go. As I said earlier on, be curious, try something else, a different way of doing something. If that didn't help, try another way. It's about keeping going, but in a very gentle way with yourself. It can be very, very easy to be hard on yourself and frustrated with your situation. So finally, I would like to say, just focus on being kind to yourself and treat yourself with compassion.